Good morning. Welcome to the briefing for COVID-19. I'm Carrie Schutte. I'm a spokesperson for the Shasta Services Agency. I'll start with the numbers. And as of last night, we have 88 total confirmed cases, including 2 from yesterday. We've done 10,291 total tests. We have 26 people in isolation and 61 on quarantine. Our contact tracers have been very busy this week. We've had 4 total deaths, and we have 3 people in the hospital right now. I'll introduce all of the folks who are here with us today. We've got Matt Pontus, the CEO of Shasta County. We've got Dr. Karen Ramstrom, our health officer. Donnell Ewert, the director of the Health and Human Services Agency. Robert Folden from Mercy Medical Center, Reading. Valerie Lakey from Mayor's Memorial Hospital District, Mark Mitchelson from Shasta Regional Medical Center, Jennifer Andrea from Mountain Valleys, and Glenn Hayward from Reading Rancheria. Dr. Ramstrom has a few things to start us out with, and then we will ask the rest of you if you have anything to share before we dive into media questions. So Dr. Ramstrom, you're on.
Good morning, everybody. So as Carrie shared, so our numbers have been ticking up, and we anticipated with opening up, which we want to do in a safe manner, that we would see some uptick. And so I wanted to just share a little bit of highlights about what we've been seeing with you all today. And so since the variance for Shasta County was approved in mid-May, our numbers have every week have been increasing gradually, some weeks about doubling, and more so in the last couple weeks. And so a couple situations we've been dealing with recently in our case investigation and contact tracing that I wanted to highlight have to do with some small gatherings. Luckily, they've been small. So we had one family gathering of a little over 20 people, we think. In addition to the case, so far we've identified 12 infected individuals with COVID-19 that attended and 2 additional close contacts. And then there was also a graduation party, small, thankfully about 11 people. And about, so far, 4 people who've attended have tested positive. And there's been 1 close contact, and I believe for that there's some outstanding tests. So just wanted to remind folks about the risk of getting together, even though, we all have these family commitments. Really just remind folks to take care if you're getting together with others. Make sure that you're limiting the numbers, preferably your close contacts or that your close social circles. And if you're sick, stay home. If you must help a family member or what have you, make sure that you're masking and keeping your distance. So just a reminder that this really can impact even those that we're close to and we love. And so I just wanted to share those couple examples with everybody. We also have a number of cases that have been, unidentified as terms of their exposure, which is not unexpected, and that we know that we have community transmission. So we, I think we've talked before, we all really benefited in Shasta County from the stay-at-home order that the governor imposed in March. And so now we're in a place in mid-May where we felt comfortable opening up. And so now it's really more important than ever that we all be really diligent and try and do our part to keep our distance and wear masks and all, so that we can continue to enjoy the businesses and other sectors that have opened and do that in a safe manner as we can. So those are my comments this morning, and I look forward to answering any questions.
Thank you, Dr. Ramstrom. Do any of our other panelists have anything they would like to share this morning?
Good morning, Carrie. So we will be receiving the new COVID Now testing machine later this week. So we'll have the ability to get the results in less than 10 minutes for our patient population. So we're very excited about that at the Rancheria Health System. But I did have one question, and maybe this isn't the appropriate form, but when somebody is tested positive and they do a tracing, are their employers notified that they have an employee that's positive, or how does that work?
Sure, I can address that. So we work closely with the individual who's tested positive to figure out the best communication with their employer. Whether if they need us to help with that, we can help with that. But we often rely on the employee to do that, and that we try not share protected information. But we then will work with an employer if they're wondering what they should be doing. We're happy to do that and have done that a number of times.
All right, thank you. That's really helpful information. We appreciate you having that available. Anybody else have anything to share before we open a meeting up?
Hi, Carrie. I have something, if it's okay. So, just wanted to kind of send it out to the community as a reminder, because we are beginning to allow visitors back to the hospital, just asking that everybody's very careful when coming to us. Yes, we screen every individual that comes into our hospital, but we want to make sure that the community is very open and honest with any potential symptoms that they're feeling. There has been an occasion people that say, well, I don't feel sick, but I have this, or this. And because of the symptoms being so minor, they don't feel like they should not be prevented from coming to the hospital. But it is those little symptoms that may develop later. And we just want asking the community to be completely open to any symptoms that they're feeling, so they don't come to the hospital and potentially expose the rest of the staff and other patients. Just communication is really the biggest key here.
Thank you, Mark. That's a great reminder. Anyone else? All right, I think we are ready for media questions.
Good morning. I've got a couple of questions for, well, Dr. Ramstrom, I guess to start with. We elevated to the level 3 high risk, but there's a little button there that says click on to learn more about the alert levels. And when you do that, it says level 3 is a moderate risk. So I'm wondering, like, which is it? Can alert us to the alert system and how it works, and that there seems to be a discrepancy in the description of what a level 3 is.
Okay, well, definitely we'll look at that and make sure that the language we're using is consistent. It is moderate, it's not high. The next level up is high, and so the levels include the new normal, low, moderate, and high. And so because of our case counts, we've bumped up into the orange, at least for the case counts. So that's in the disease status category, and that's what put us into the orange, the moderate alert level. We also have bumped up since last week in terms of some other measures that are at level 2. So our positivity rate, because we're testing symptomatic contacts, and so we're testing when we're symptomatic people. Again, just a reminder, we want to keep our positivity rate of our tests low. That means we're testing large number of asymptomatic people and doing some surveillance. And then we've also increased a bit in terms of, I guess that was it. Yeah. So, but we'll double check that, Mike, to make sure that that's consistent on our webpage. Thank you for that.
Oh, thank you. Is there a magic number that would push us into level 4, a magic number of cases?
So if you there's a link on the web page that actually gives you the full COVID alert level framework, and so there are a number of indicators that actually could put us into to the high alert level.
Okay, I'll have to do my homework. I have one more question for you. I'm only picking on you because the sheriff isn't there. Apparently there's been already a couple of weekends of races at the drag strip, and supposedly there's a pretty big race coming up this weekend, Friday, Saturday, Sunday. Have we addressed that, done anything about that?
Right, we were just learned about that yesterday. We weren't aware, and so we were talking late yesterday afternoon about options, and so we'll be following up on that to make sure that they know what is allowed, and We actually have had some interaction with them previously in terms of prevention measures, planning to open, and so our understanding was that they were not. So we'll be following up on that.
Okay, are you concerned about that? You know, the potential size of that event?
Absolutely.
Thank you.
This is David Bendo with the Record Search Site. I want to follow up on the news yesterday that the DIP is temporarily closing. They announced on their website or on their Facebook page that they decided to close after all of them were exposed to someone who tested positive. Did the county work with the DIP and suggest that they close? I mean, was that a result of a contact trace? Can you explain how that all kind of worked out here?
So I don't have a lot of details on that, but that it's really up to a business to make that decision. And since that happened yesterday, I don't have a lot of information. I do know that there was some concerns in that establishment, and so we'll be getting more information on that today. But really, a business can make that decision anytime on their own, and I anticipate I believe that that's what's happened in this situation.
Did the business contact the county before it made that decision?
So our nurses, our case investigation team and contact tracers would have been involved with the individuals who tested positive. And in that communication, I actually don't know what was communicated directly with that business, if anything, yesterday. So I just learned about it first thing this morning as well.
So can I follow up? What can I find that out, whether the county was was contacted, and also the potential the Facebook post just said all of us were exposed. I assume there were customers in there too. So the potential of how many people were exposed to this person that tested positive. Can I get that answer?
So if it's a recent case, it can take us a while to actually identify all the exposed. And so that investigation will be in the works. And so we might not have a final number yet. I can guarantee you that we have been in conversation with any of those contacts that we've identified, and have communicated with them, and would have been, either isolating or quarantining them depending on if they had symptoms, and excluding them from work so that they would not be there. And so that may be what resulted in the business making that decision.
Thank you.
I just want to make a comment about risk again. That we do have established community transmission of COVID-19 in our community, and we think it's been increasing over the last several weeks. And while it's good to know when there's been a case in a certain place, we should all be assuming when we go out that there are cases, people who are infected around us, and they may be asymptomatic, they may have mild symptoms. And that is why we need to continue to use those precautions in all the public places, whether it be social distancing, using sanitation techniques, and using face coverings. And we also want to encourage everyone very strenuously, once again, if you are ill, please stay home.
All right, other media questions?
I do.
Okay.
Good morning. Hey, I have a question similar to Dave's and Mike's, and that's regarding there is apparently a Shasta High School private grad night that's going to take place on Wednesday, July 8th at Waterworks Park. And I was just wondering how the public health is reacting to that. Or are you aware of it? And is there any plan to notify them and request that they do not hold that event?
So I don't know, Carrie, if you've heard about that. That's the first I've heard, but we meet with our staff every day who actually are working with different business entities in the community. And so that may be that they would be bringing that to us this afternoon. I don't know if anyone else knows anything about it, but we will follow up.
Thank you. I learned it on Facebook, of course. I have one question, and I apologize if this has already been addressed in the last 2 weeks. I missed the meetings, but Dr. Ramstrom and Carrie, I was wondering if you and your department and your staff had received any negative threats or reactions from people in the public who are angry about having to comply with restrictions.
In the public information office, we have not. There's certainly there are people who are very adamantly opposed to following the mask guidance, but in terms of threats of any kind, no, we haven't gotten any threats. Looks like Dr. Ramstrom has something to add.
Yeah, there have been comments on social media, and there's been sharing of emails, and so we get some emails of people who have concerns. So, yes.
Any other questions for the group today? Okay. Thank you, everybody, for being here. I also wanted to give a shout out to our sign language interpreters. They're here with us every single week. They have been from the very beginning, even when we were in person back in the Boggs building, what seems like about 5 years ago. So thank you for helping us keep our all of our community able to see and hear our briefings. Thanks very much. We'll see you all next week. Have a great day.